Hello, my name is Stefano Bonaccina. I work at the Health Informatics Center of the Department of Learning, Informatics, Management and Ethics at the Karolinska Institutet. Now I'm going to speak about the electronic health record. The electronic health record, or EHR, is the main e-health application for care professionals. It is the electronic system they use to document what they know about the patient and the diagnostics and treatment they perform. The electronic health record collects the data and the information gathered during patient courses in healthcare settings according to a longitudinal time frame. The purposes of an electronic record are supporting clinical decisions about patient according to medical information it contains, facilitating the communication among units in healthcare settings, caregivers and clinical staff members over time too, providing data and information for operational management, evaluation, and research and more, and satisfying legal requirements about healthcare documentation according to current law and regulation. Data collection and information access are the main requirements to meet for achieving these purposes. For achieving a proper and safe care, usually the content of a medical record is organized in a structured way. The sections composing the medical record are patient identification, which relates to the identity of a patient according to a country regulation. Demographic data, which includes contact information of the patient. Chief complaint, the significant or serious symptoms or illness described by the patient himself or herself, or the signs the doctor is able to identify on the patient body that makes the patient sick. History of present illness, past medical history, which includes previous treatments or drug therapies along with their prescriptions. Family history, which describes the family relationships of the patient along with relatives' medical history. Social history, review of systems. The doctor asks a series of questions to the patients about different body systems for identifying signs and/or symptoms he or she is experiencing or experienced, and physical examination, which reports the results of visiting the patient, and laboratory tests. In addition, signal recordings, for example, the electrocardiographs, radiologic studies, and other image or chart-based reports compose a medical record. Those heterogeneous types of information are collected and then used by different healthcare professionals, including doctors, nurses, physiotherapists, midwives, and the patients themselves. The sections of an EHR are arranged for better performing the diagnostics and defining treatments on the patient. To this end, a so-called SOAP structure is followed. SOAP stands for Subjective Objective Assessment Plan. A medical professional, for example a doctor, collects both subjective measurements, such as chief complaint, history of present illness, past medical history, family history, social history, review of systems, and objective measurements, such as physical examination, laboratory tests, and radiologic studies, and makes assessment based on these, that is the diagnosis, and then plan different treatments based on this diagnosis. After diagnosing the patient, treatments are agreed upon and documented in the EHR, as are the outcomes of said treatments. For patients with chronic or multiple health issues, the EHR can include large amounts of data that can be quite challenging to review. Most EHR systems present the healthcare professionals' notes in a reverse chronological order, with the most recent notes first. However, being able to search within the EHR is crucial in order for healthcare professionals to be able to find the information they need. The evaluation of an EHR system is based on diverse factors. The usability is a major aspect, as healthcare professionals have to interact with the system daily. Another crucial aspect is the response time the inquiries are performed. To sum up, in the context of e-health and health informatics, the concept of the electronic medical record is extremely important. And more practical examples of the use of and context of an EHR system will be given in the next video.